We are here today with this distinguished panel to discuss some of the results of the UNITE study presented at this meeting and maybe to summarize the study a bit. So I will start with a brief summary. So UNITE is a retrospective study specifically looking at outcomes in patients with metastatic urothelial cancer who are treated with targeted agents. It started out as a database to look at outcomes with enfortumab vedotin, which was approved a few years ago. But subsequently, we've expanded to other targeted agents as well, including sacituzumab, govitecan, and then erdafitinib. And initially, as part of this study, we really wanted to assess whether in the real-world setting we would see the same outcomes with enfortumab vedotin as well as with other targeted agents that we were seeing in clinical trials. And so our initial publication was a couple years ago now, which did highlight similar outcomes with enfortumab in this real-world patient population. And then moreover, we also wanted to focus on specific patient subsets of interest, in particular, perhaps patients who would not have been included in clinical trials, such as patients with specific comorbidities, patients with variant histologies, and as well as other populations. Where we wanted to see what the outcomes are with enfortumab and then other targeted agents. Subsequently, we've looked at a number of other questions, and at this meeting, we had a number of abstracts and one oral presentation as well. This is at ASCO GU 2024, and so we will discuss some of these today with this distinguished panel. And so I will maybe start out with Amanda, maybe with a summary of your rapid oral abstract presentation with enfortumab vedotin following switch maintenance of Avelumab. Maybe we'll start us off there.
Yeah, thank you, Vadim. Thank you, GU Oncology, now for having us. So in this analysis, we investigated outcomes in patients who had platinum-based chemotherapy and then maintenance of Avelumab. Those patients were not included in the investigational trial EV301 that led to its FDA approval. So this study was selecting for patients who responded to platinum-based chemotherapy. So we found 49 patients who got sequential platinum-based chemotherapy, maintenance of Avelumab, and then enfortumab vedotin. We looked at observed response rate, progression-free survival, and overall survival from EV start, and then overall survival from platinum-based chemotherapy start in the overall cohort. We also investigated outcomes in subgroups of interest, so based on type of platinum-based chemotherapy received, median time on maintenance of Avelumab, best response to platinum chemotherapy, and then also Belmont risk score. And so in terms of overall outcomes in the overall cohort, so observed response rate was 54% in the evaluable patients. That was 41 out of 49 patients. And the intention to treat population, it was about 45%. That's pretty similar to what we saw in EV301, which is about 41% in the intention to treat population. In terms of median progression-free survival, it was 7 months, and the median overall survival was 13.3 months. Again, pretty similar to what we saw in the EV301 trial, which was 5.6 months and 12.9 months, respectively. Now, when we looked at subgroup analyses, we actually didn't see any differences based on platinum therapy type used, median time on Avelumab, or on best response to platinum-based chemotherapy. However, patients with Belmont risk score 0 or 1, meaning those patients without visceral metastases such as liver metastases or anemia and or poor performance status, did actually better with progression-free and overall survival. So
yeah, well, and to maybe follow up on some of this, which is really interesting data. But why were these some of the endpoints that you focused on or wanted to focus?
Yeah, so essentially we wanted to see what if patients getting this in the real world in platinum responsive patients were having similar outcomes to those who are getting sequential platinum-based chemotherapy, checkpoint inhibitor therapy, and then EV.
And what was the median follow-up again?
It was 8.5 months.
5 months, which is, I mean, I think you guys would agree, is potentially relatively short.
Relatively short, yeah. And then we also saw that the median time in Avelumab was shorter than what we saw in Javelin Bladder 100. So patients here the median time on Avelumab was about 3 months, whereas in Javelin Bladder is 6 months. And one of the reasons for that is because the UNITE registry is designed to capture people who are getting onto enfortumab vedotin. So over time, we're capturing the people who are progressing on maintenance of Avelumab more quickly.
Yeah.
I think that explains that.
And so, okay, so potentially this population may be a little bit
A
different.
little bit skewed, yeah.
And that explains some of those numbers.
Yep.
Well, I don't know if you guys have any follow-up questions, because then otherwise I'll ask more.
Yeah, I mean, I think what I really love about this is that as we go across a lot of different sites in the US that are certainly academic centers, but we have tremendous power, I think, when we all work together to answer these questions that are very tedious and are really not possible to ask from a true trial population. The average patient that comes into our clinic typically is not a perfect fit for a clinical trial. And there are very select patients that have excellent performance status, perfect laboratory parameters. And the Unite effort allows us to look at populations of patients that truly are who we see in clinic each day. And I think, this is an example of work that really helps inform us of a question that is very relevant, especially as we now have combination data in the front line. And where does the switch maintenance factor in? So I was very proud to participate in this work, and you did a great job presenting it today.